All right, hey everybody, welcome back to part 2 of our video series on the 11 reasons you can't get rid of and shake SIBO. I'm Dr. Hagmeyer, and just as a reminder, this is part of my Everything You Want to Know About SIBO video series. And so if you're just tuning in, I want you to know that there's about 9 or 10 other videos in this series that are worth checking out. This is a very, very comprehensive video series that I've done that talks all about SIBO and the finer points about SIBO and treatment and some of the things that cause SIBO to relapse. I have been getting a lot of emails over the last couple months asking if I would do a video series on my thoughts about why so many times treatment for SIBO is unsuccessful. And so that's what this video series is. This is the second part again of the video series. You may remember, if you did watch the first video series, then you remember that, and we talked about things, we talked about the 5 reasons why you can't get rid of and shake SIBO. And so today we're really just digging deeper into those reasons of why SIBO can be so challenging. When you consider, SIBO, and you consider all the things, that can go wrong, unfortunately, it might seem like a daunting task to tackle SIBO. And in some cases, there are a lot of considerations, and it can be a very challenging problem to deal with and really overcome. But I promise you, the chances of the successful treatment and treating SIBO successfully drastically improves when you approach this with a plan, a roadmap, and you're methodical about the process, right? SIBO requires an understanding of the big picture. And again, one person with SIBO's big picture is going to be different than another person's picture with SIBO. This is why, again, the treatment really needs to be customized to the individual. One thing I promise you is that if you do this, and you approach this methodically, and you approach this with, some thought, you'll have the best chance of overcoming even the most challenging cases of SIBO. And so that I promise you, I've seen that over and over again. So in today's video, we're going to dig a little bit deeper. We're going to get into some of the other things like biofilms. We're going to talk about probiotics. We're going to talk a little bit about prebiotics. We're going to talk about things like a vagal tone, and we're going to talk about low ileocecal valve pressure and what those are. And also, when your IBS or SIBO might even be and have a underlying connection to an autoimmune problem, right? We don't typically think of SIBO or IBS being autoimmune, but we'll talk about that in detail a little bit as well. So let's jump into reason number 6 why you can't get rid of and shake SIBO, and that brings us to biofilms, right? If your IBS is the kind where you either have IBS constipation or you have IBS mixed, or if you've already had a breath test and you're methane dominant, if any of these are you, I want you to pay very close attention to the possibility of a biofilm. A biofilm is a collection of microbes. It could be bacteria, it could be yeast, it could be archaea, and what happens is these microbes, they stick to the surface and they wall themselves off with a very sticky protective coating called an EPS matrix. And the purpose of the microbes forming this biofilm is for one reason, and it's designed to protect themselves from being attacked by your immune system and the antibodies that your body may create to attack them and destroy them. These biofilms protect these bacteria from antimicrobials. They protect them from antibacterials and so forth. And so it's a self-sustaining environment. It's the way these bacteria protect themselves, right? If you have undergone treatment and you haven't felt better, or you have infections that you can't shake, they keep coming back, okay? I would then consider biofilms in that particular case. If the topic of biofilms really interests you, I did do an entire video, I did dedicate an entire video on this topic where I review what a biofilm is, I talk about how to naturally break down these biofilms, some of the mistakes people make when they start taking biofilms, and some of the scenarios that make me think that a biofilm is present. And finally, I talk about some of my favorite biofilm disruptors. So again, if that's something that is of more interest to you, you can go back and watch that. I want this video, these 2 videos, really to be an overview of the most common reasons why treatment fails. So again, you can go back and watch those if that's something that is of more interest. All right, so moving on to number 7 as to why you're not shaking SIBO is that your treatment plan is missing a prokinetic, or you haven't found the right prokinetic for you. So a prokinetic or prokinetic agents are substances that increase gastrointestinal motility. What they do is they stimulate the cleansing waves, or they stimulate the strength or the frequency of those contractions in the small intestines. Prokinetics can also stimulate the contractions within the stomach, causing the emptying of the stomach contents, right? So sometimes motility of the intestines can, for a number of reasons, get off track. Sometimes the muscle contractions don't happen when they should. Sometimes they don't happen as frequently as they should. Sometimes those contractions aren't strong enough, or sometimes they just don't last long enough. All of these things will go on to affect our motility. And this, again, is where prokinetics can be incredibly helpful. Now, there are natural prokinetics, of course, and then there are drug-based prokinetics. You know, drug-based pharmacological prokinetics are things like low-dose erythromycin, LDN, Zelnorm, and there's a few others, but you know, those are the big ones that I often see people being prescribed. There are many natural prokinetics. These are going to be things like ginger and 5-HTP, which is a precursor to serotonin. Things like Cape aloe, triphala, serotonin, peppermint oil, and again, various Chinese herbs are also used as prokinetics. What I find about prokinetics is that, what's super important about them, for that matter, is that patients who have methane-predominant SIBO, maybe these are your patients that have constipation, but they also have constipation and diarrhea, so this is mixed IBS. So if you have methane-predominant SIBO or mixed IBS, prokinetics can be very, very helpful here. Again, they can stimulate and reset those cleansing waves, and this is one of the major pieces of conquering SIBO, are those migrating motor waves and those cleansing waves. If you want more information on prokinetics and the ones that I use in my office with good success, I'll leave a link in the description of today's video and on my website in this section of the blog. And again, you can go back and you read more about what those favorite prokinetics are. One other thing I want to really stress is, if you haven't seen this video yet, I highly suggest that you watch it because those people who take prokinetics are often doing them all wrong. And I go over what those mistakes are. So again, you may want to go back and watch that video as well. The next reason why people with SIBO can't shake it, why it relapses, and why it's so challenging, and this is kind of a more serious complication, and this one has to do with autoimmune IBS or SIBO. 10 years ago, we didn't think of IBS again as being potentially an autoimmune disease. It didn't fit the criteria of other GI autoimmune diseases. You know, after getting a colonoscopy and ruling out things like celiac disease and Crohn's disease and ulcerative colitis, if you didn't have any of these, your doctor diagnosed you with IBS and basically said, you know, have a nice life. Eat more fiber, take your Metamucil, take your Imodium AD, and then it was, you know, come back every year or so for another colonoscopy. So for years, many of these patients suffered, and they lived through all of this with this diagnosis of IBS, which is important to realize that if you've been diagnosed with IBS, basically what that means is it's a diagnosis of exclusion. It means you don't have an inflammatory bowel disease, and your GI doctor can't find anything wrong structurally, so the diagnosis of IBS comes along. All right, but recent research showing that some patients who have IBS and some patients who have SIBO have an immune mechanism that's gone haywire. And so if you have autoimmune IBS, this is in part thanks to the work, the work that's been done by Dr. Mark Pimentel. Right, to determine if you have SIBO or IBS as an autoimmune piece, you need to have special testing, and that is something that's going to look at antibodies against a structural protein called vinculin, which is again a cytoskeleton protein, and you also need to have a test that looks at a toxin called CDTB, or cytolethal distended toxin B. Now, what's important to understand about these two markers is that this toxin, the CDTB, is made by E. coli, Salmonella, Shigella, and Campylobacter. Right? All of these bacteria produce a common toxin, and that's the toxin we're talking about, CDTB. And we can measure that toxin, right? We can measure the immune system's reaction to that toxin. Now, the thing to understand here is that these toxins have a major role in causing a breakdown in the tight junctions. And so if you know anything about those tight junctions, or have heard other videos that I've mentioned this tight junction, this is leaky gut. This is, again, if you've ever heard of this, this is where the tight junctions become weak, and now toxins further weaken the tight junction and the epithelial cell lining. And so the overwhelming majority of people who are diagnosed with IBS are people who develop that IBS after an episode of gastroenteritis, which again stems from the bacteria that I just mentioned, right? So if you can recall a bout of food poisoning and your bowel movements were never the same after that infection, then it's very possible that your IBS has an autoimmune component. If you've traveled to other countries and you got a bout of traveler's diarrhea, again, this is another potential red flag that you should be thinking, hey, this is a possibility. Maybe I need to be tested in this. Now, I find this test very helpful in patients who have already been diagnosed with irritable bowel syndrome with diarrhea, but also those patients who have been diagnosed with mixed irritable bowel syndrome, okay, the flopping back and forth between constipation and diarrhea. Studies that have been done so far show that this test not only confirms post-infectious IBS diarrhea and IBS mixed, but most importantly that it has a 90% specificity rating, which means that 9 out of 10 times, if this test comes back positive, you can bet that part of your problem was due to this post-infectious event. And then, of course, what you want to look at is which markers were elevated. Was it the vinculin antibodies, the anti-vinculin antibodies rather, or the cytolethal distended toxin B? So here's the kind of scenario that plays out. Let's say you go to a friend's house for dinner, for a dinner party, and some of the food, maybe you're eating some meat or whatever it is, was contaminated with this bacteria. Maybe you ate some bad food and it had some salmonella, or it had E. coli, or it had shigella or campylobacter. It was just the toxic soup sitting in that particular food you were eating. You go home and you spend the next day or two in the toilet, right? You're having things come out of you that you never knew lived there, right? Maybe you go to the doctor, maybe you don't. If you don't, let's say because you're feeling better, life goes on, back to normal, back to the everyday, daily grind, so to speak. And within a few days, of course, you're back to your normal, usual routine, and so forth. And so months later, you now start to develop these symptoms of IBS. Well, those same bacteria, that salmonella, the shigella, the E. coli, and the campylobacter, will produce these toxins, and that's the cytolethal distended toxin that I was just talking about. And one of those toxins, right, is what we want to measure, right? Your body naturally produces antibodies against these toxins, and we can measure those. And that's what the antibody test really looks at, is it looks at how your immune system has identified that particular toxin. Now, because these toxins are very similar to the tight junctions of your body, like we just talked about, the mucosal lining in your intestines, this is where we can actually see this leaky gut coming into place as well. If you look at this illustration here, you're going to see that your immune system begins to attack the proteins of your body, and it begins to attack your gut barrier, leading to that leaky gut. But the story doesn't end here, and this is not why you end up with that soft, mushy, loose stools. These antibodies rather, cross-react with another protein, one that regulates the activity of the migrating motor complex, and this protein called vinculin. And when the immune system attacks vinculin, it shuts down that migrating motor complex, or the MMC. And I talked about these cleansing waves in a video titled Getting Relief from Diarrhea. But these waves are absolutely critical in maintaining a clean, a healthy intestinal environment, right? Vinculin is the connection between the migrating motor complex and bacterial overgrowth. If you test positive for these antibodies against vinculin, then this is one of the reasons why you have bacterial overgrowth. So the next reason you can't get rid of SIBO or shake SIBO has to do with the ileocecal valve. So reason number 9 is low ileocecal valve pressure. Now, you've probably heard of leaky gut. I've been talking about it today. Maybe again you've watched or read some past articles about it. But if you have a leaky gut, you could potentially also have a leaky ileocecal valve. Many studies have been done looking at the connection between low ileocecal valve pressure and its connection to SIBO. The research is pretty clear in that a problem with the ileocecal valve contributes to SIBO. There are several structural causes of SIBO, and when a person has this ileocecal valve dysfunction, this would fall under one of the categories where there's a structural problem, right? So what is this ileocecal valve and why is it so important? Okay, so I want you to look at this picture here. This ileocecal valve is what separates the small intestines from the large intestines. And the main job of this valve is to prevent the backflow of material from the large intestines back up into the small intestines. In a healthy bowel, this valve is closed the majority of the time, and it opens when the pressure is applied by the contents in the small intestines. So when there's low pressure, the valve stays open, and the very definition of SIBO is when the bacteria in the small intestine, and the large intestines rather, migrate up into the small intestines, right? That's where our problem is. And again, that's in part regulated by that ileocecal valve. So remember, we don't want bacteria from the large intestines coming up into the small intestines. Things go down and out, not up, right? So if a person tests positive for a hydrogen breath test, the bacteria that produce hydrogen will keep the valve open. And that allows, again, the bacteria to migrate upwards. And again, this is why frequent bloating is a common factor, is a common cause in bacterial overgrowth, due to the fact that that bloating itself is keeping the valve, that ileocecal valve, open. Right? It's producing and creating the environment by keeping the valve open and allowing that bacteria to come up into the small intestines. So how do you know if you have a problem with the ileocecal valve, right? You might be wondering that. And so you could, of course, get a colonoscopy, or you could swallow what's called a wireless motility capsule, or WMC, to confirm that. But there are a couple of symptoms that, without a doubt, in my mind's eye, most likely indicate that there's a problem with the ileocecal valve. And so I want to share with you those 3 scenarios that indicate that you have a problem with your ileocecal valve. Number 1, do you feel pressure under your ribs or pain on the right side, to the right of your belly button, angled at about 45 degrees, right? If you see this picture here, this is the location of where your ileocecal valve is, right? So if you palpate around that area and you feel tenderness, that's a good indicator that you've got some problems with your ileocecal valve. Number 2 is, do you have back pain, right? Does that back pain wrap around the right side of your back, all right? Do you have right shoulder pain? Well, this could also be a problem related to the gallbladder. It may also be due to the ileocecal valve. And so if you answered yes to any of those questions, I want you to go back, watch the video series that I did that talks about how to release that ileocecal valve through various self-massage techniques. Again, this is something you can do yourself. This is something that if you have someone in your house that they can help you with. But if you're not comfortable doing it, the other thing is here, you can actually go to, a chiropractor. You could go to a massage therapist. You could go to an acupuncturist. You could go to a physical therapist. You could go to an osteopath. So again, just get on the phone, call a couple different offices, and find out who might be able to help you with that. All right, moving on to reason number 10, why you can't get rid of SIBO and why you can't shake SIBO, is that you have poor vagal tone, right? Physical stress, chemical stress, emotional stress affects our vagus nerve, right? And that vagus nerve is one of the most important parasympathetic nerves involved in our gastrointestinal motility, right? Nerves carry signals back and forth from one part of the body to the next, right? From the brain to the organs of the body. That's what those nerves do. And the tone of this nerve sets the stage for inflammatory conditions, high blood pressure, depression, and really all kinds of digestive problems. So this vagal tone is very, very important. Now, a very common problem that we see that interferes with vagal tone are, of course, the past and even sometimes the current and present emotional stressors that we're going through. So poor adaptation to stress causes a condition affecting the HPA axis and causes dysregulation in the adrenal glands, right? It's a very important area to work on. Ultimately, when you get into this fight or flight state or this sympathetic dominant state, you can't sleep, you can't think straight, you have brain fog, you are irritated, you find yourself jumpy, you find yourself restless, right? Things like the littlest amount of noise startles you. And after a period of time, if this isn't corrected, you find yourself drained and exhausted, right, in life. Well, this fight or flight can't keep up forever. And of course, it's not the state that you want to be in if you have small intestinal bacterial overgrowth or really any other GI problem for that matter, right? So you can't digest food in a state where stress is affecting your GI function in so many different ways. And if this is you, it's super important that you work with a doctor who practices functional medicine and can evaluate this HPA axis through a saliva test and see what can be done about resetting and balancing that part of your nerve system. There may be certain lifestyle habits that need to change, right? There may be certain aspects of life that are causing you a lot of stress. Maybe it's your friends. You may have to ditch your friends. But there may be something that has to be done in order for you to overcome this plateau. So some of the things you can do to help improve vagal tone include things like chiropractic care, things like acupuncture, slow, deep belly breathing, diaphragmatic breathing is very helpful. There are different kinds of exercises like gargling and humming and singing. Meditation can be very helpful. And then there's also something that you do where you do alternate nostril breathing, believe it or not, where you just plug up one nostril and you breathe through the other one, all right? And then you repeat. Humming, like I said earlier, that can increase something called your heart rate variability. Exercise can help improve that too. So some studies actually, as it relates to inflammation in the vagus nerve, are showing that when there's inflammation in the vagus nerve, that we often also end up with brain inflammation. Like that, what we would see in patients with Alzheimer's disease or Parkinson's disease and dementia. I forget what video it was that I did, but I talked about that vagus nerve, and I talked about how very often if there's inflammation in the gut, that inflammation in the gut can irritate the vagus nerve, and that vagus nerve traveling up to the brain can lead to things like Alzheimer's. There's several studies that you can go back and you can actually look those up. So again, this can be an important area that often gets overlooked in patients with SIBO, that balance between the sympathetic and the parasympathetic nerve system. Again, those are all things that I think are very, very important. And again, the bigger picture. Some people may suffer with those. You may not be suffering with those. Again, that's all part of what makes you who you are, right? The last reason that you can't get rid of and shake SIBO deals with expectations, right? And this is a big one. All too often, the expectations of healing in SIBO aren't realistic. And so the one thing I would encourage you is if you have SIBO and you've been working with a doctor and you're not getting any better, it's very important if they're working on all these areas that we've been talking about in these videos with you, and they are aware of these things and they have the know-how of how to correct these things, then sometimes it's just a matter of time. I truly believe that the power of our mind really does influence how we heal. And so it's important to not only be positive and, of course, surround ourselves with people that are positive, but along with that, maintaining a healthy mindset. We also need to have realistic expectations. Sadly and unfortunately, eradicating SIBO can take a few weeks in some people, but correcting why the SIBO is there in the first place can take months. Easily it can take 6 months, 12 months, 18 months, again, just depending on what your big picture is, okay? It's also not something that you treat one time and with one round of antibiotics and one round of antifungals, and then it's done. My experience is that people who have SIBO often need several rounds of treatment. And if you're one of those patients who has thyroid disease or polycystic ovarian syndrome or endometriosis or lupus or diabetes or Crohn's or post-traumatic stress disorder or depression or fibromyalgia, and you have a history of taking lots of medications, right? Medications like antibiotics, medications like thyroid medications, birth control pills, antidepressants, acid reflux pills, steroids, pain pills, right? Immune system modulators, as in the case of RA or Crohn's. All of these things affect your microbiome. And the longer you've been on these medications, the longer your journey is going to be. So again, I think it's very important just to be realistic and don't compare your case of SIBO with the next person or with your Facebook friend who has SIBO. What I find in many cases like this is it's important to focus on it's more important to focus not only on the killing of the SIBO and the co-infections, but again, looking at all these scenarios that are going on. You and your doctor may need to put an emphasis on gut healing in the initial stages, or maybe dietary changes, or even emotional stress in your life, or detoxification, and start making some headway in those areas, and then focus on repairing the gut lining. All right? It's also important to understand that with SIBO doesn't always respond to the Newcomb mindset that is so prevalent among holistic doctors today, right? Sometimes we need to heal and repair that gut long before we can start, a kill phase, if you will. One other thing to keep in mind, and I've said this over and over, is that when it comes to testing, whether or not you're hydrogen dominant or methane dominant is also very important, because those people that are methane dominant, without a doubt, this is going to be a more difficult, more challenging case than just treating a hydrogen dominant case of SIBO. The other thing too is if you have vinculin antibodies, anti-vinculin antibodies, or you have exposure to cytolethal toxin B, descendant toxin B, those are also risk factors, okay? When it comes to, I want to go back to just for a moment here, I kind of got a little sidetracked there, but when it comes to hydrogen breath testing, one thing that's very important is when you first get your initial levels taken, it's important that whenever your doctor or you determine when you're going to retest those areas, what's important to see is did the levels come down from the initial test? Even though you're not feeling better, if the levels are coming down, at least you're moving in the right direction, right? So there's some things that I've talked about in that as well. When you read about the person in your Facebook group that has SIBO and all they needed to do to get better was they take betaine hydrochloric acid or take probiotics and follow a low FODMAP diet, and you did all that and it didn't work, don't beat yourself up, all right? I see too many people beating themselves up for not getting better, all right? So don't do that. It's easy to see how one can get depressed and frustrated and give up, and then sink lower and deeper into physical and emotional stressors. But just keep in mind that this is really a marathon, and the only one that you are competing against is really yourself. Okay, so just hang in there. You'll find the right path. You'll find the right doctor if you haven't already. So. I showed this in the last article, in the last video I did, the first part of this video series, but it's also worth mentioning here again. And as I bring this video to a close, I want you to see this, what it says in this medical journal about the treatment of SIBO. And it says this, it sums up the treatment philosophy of SIBO fairly well. It says, therapy for SIBO must be complex. It must address all the causes, symptoms, and complications, and be fully individualized. Prognosis is usually very serious, determined mostly by the underlying disease that led to SIBO. And again, I really couldn't agree more with that. What led to the SIBO? Again, what's the root cause? So I hope you enjoyed today's video. I hope that you found it useful and informative. If you liked it, give it a thumbs up, comment on it below. If there's a topic that you want to see that I haven't done on SIBO yet, leave that in the comment section. And of course, if I get enough videos or if I get enough people asking it to learn or hear more about that particular topic, we'll wind up shooting a video on that as well. So until next time, take care.